When somebody comes to you for eyelid surgery, what are the common complaints?
Oh, the complaints that people have when they're interested in an eyelid lift or blepharoplasty are fairly universal. For women, the complaints are, I look tired, I look angry, I can't put my eye makeup on. And for men, similar, of course not the eye makeup, but they say, I look tired or angry, and also sometimes when I'm driving, I can't see on the sides very well.
So who's a good candidate for this type of surgery?
Many people are a good candidate for this surgery. Like all of our surgeries, we want happy, healthy patients, no major medical problems, no bleeding disorders. If they have high blood pressure that's under control with medications. So the best candidates then are patients who have excess upper lid skin or creping laterally.
Does insurance cover this type of procedure?
Occasionally, insurance will cover an upper eyelid lift or blepharoplasty, but it won't cover a lower eyelid lift. To get the procedure approved by insurance, you would have to prove that the degree of sagging or upper eyelid ptosis is causing interference with your activities of daily living, like driving. So you'd have to see an ophthalmologist, get visual fields taken, but this is getting tougher and tougher as insurance cracks down. Occasionally, very, very rarely, insurance will cover a brow lift, but insurance, again, will never cover a lower lid blepharoplasty, which is strictly cosmetic.
What are the risks involved?
Like any surgery, there's always a risk of bleeding or infection, but particularly with a blepharoplasty, the major risk is bleeding. And that's why we only will do a blepharoplasty on patients who have medical issues like blood pressure under control or off any bleeding medications and are, generally healthy candidates. Another risk, which not a risk but can be a side effect of the surgery, is either not enough skin is removed or too much skin is removed. Obviously, I would always err on the side of removing not enough skin, so occasionally the patient will need a touch-up for a little bit more skin removal.
Dr. Temmen is extremely calming when she's in the room with you. She explains everything very thorough. She's extremely thorough, and she just kind of puts you at ease.
How long does it take to recover?
The recovery from a blepharoplasty is not that difficult physically because the pain is rather limited and the surgical intervention is small. However, a lot of patients will have bruising and swelling for a fairly long amount of time, a couple weeks. So we say that our patients will be public ready in about 2 or 3 weeks.
What about the wrinkles around your eye? Does this surgery get rid of those?
It can help with the wrinkles. The smile lines around the eyes or the crow's feet that angle upwards towards the eyebrow can be improved with blepharoplasty. The smile lines or crow's feet on the lower eyelid are more difficult to improve with just an upper lid blepharoplasty and would have to be treated with a lower lid blepharoplasty or other resurfacing procedures or even Botox and fillers.
Would I be asleep during the procedure?
If we strictly do a blepharoplasty, the skin-only blepharoplasty can be performed under local anesthesia, meaning a small shot to numb the area, and then the surgery takes about an hour and patient goes home. Very simple. But a lot of times our patients have other procedures performed at the same time, such as a brow lift or a facelift, and those patients will have general anesthesia.
What about stitches and scarring?
Most of the stitches are on the inside though and are dissolving, so the patient will never see them or feel them. On upper lid blepharoplasties, I usually do use a suture that has to be removed after about a week. But for the lower blepharoplasty, the lower lid surgery, the sutures on the inside and on the skin are dissolving and don't have to be removed. Because the skin of the upper lid and the lower lid is some of the thinnest skin on the entire body, the skin burden is very, very low, and it's very rare that you will actually have a visible scar, say a year after surgery.
When you hear that somebody is good at something in a procedure that you want to have done and somebody is experienced and comfortable and confident, you run towards them and you want to have whatever procedure you're having done by somebody with those credentials.
Health Matters will be right back.